Hello.
Hi, Yasudha. Can you hear me?
Yes, I can hear you, Doctor. Hello and happy evening to one and all who have joined us today. I trust all of you are keeping well and keeping safe during this pandemic. Uh, I'd also like to thank Fizart for sponsoring this webinar. And this is our COVID 19 webinar series number 3. So I would like to welcome Dr. Karthik Ram, Chief Plastic Surgeon from Chennai Plastic Surgery. And today we are going to be talking everything about COVID and tips to keeping safe. Welcome, Doctor.
Thanks for me for you sir, guys to invite me and this interesting seminar and interesting webinar. And I love to share the knowledge what I gained during this pandemic. And we went through a lot of information about this pandemic and the viruses. And I want that whole community to know as long, like how much ever you are educating the public about this, we will come out of the situation very fast. That's what I believe in. So I hope we can do a part of that here.
Okay, thank you, Doctor. So I would like to say, first of all, that we have a set of questions, and because this is an interactive webinar, we will also be taking questions from participants. So I would like participants to keep themselves active and kind of give in your questions through in the chat box or raise your virtual hand, whichever works, so I can take the question on behalf of you. So we'll move on to the questions, Doctor, so we can start the webinar.
Sure.
Yeah. So, Doctor, we've been hearing about COVID all the time on news, on paper, on everything, and even friends talk about this and families talk about this. What is this COVID-19, and why is it different from all the other types of viruses?
See that COVID-19 is a kind of a comes in the family called coronavirus. See, we call, like as a layman term, we call this COVID-19 also as a coronavirus, but actually coronavirus is a virus which produce cold-like symptoms to us. So everybody, we should have got the coronavirus sometimes in our lifetime. Okay? It's a common cold. There is a 7 types of coronaviruses are there. Out of 7, the 4 types are very common among public. It won't do much harm, so it comes like a common cold and disappear. Okay, so other 3 deadly viruses in coronavirus family are something called SARS. Okay, SARS is a severe acute respiratory distress syndrome. It's one kind of a COVID. It like in 2000, if I'm not wrong, 2013, it spread like everywhere, and they controlled it. And the mortality is very high for SARS. You should understand that the mortality of SARS is very high compared to the what we are going through now. Okay, that is that is almost 15-16%. But next. Next in coronavirus family is that other virus called MERS. It is a Mediterranean virus. Usually, like they thought that they found out it spreads from the camels to the humans, and it has a mortality rate of 35%. Okay, those are not contained, and now also once in a while the packet of MERS and SARS, coming and disappearing in few places. But those things that like those are all gives us symptoms first, then we can easily pick up, okay, these are all the people have the problem.
Okay.
Next comes the 7th virus in the coronavirus family is the COVID-19. It's called SARS-CoV-2. SARS CoV-2
Oh,
is the second virus in the SARS family. So
okay.
so this virus, the major problem is you take any like the epidemic or deadly like viruses like Ebola and any viral illness, symptoms comes first, then only the infectivity will happen. But this case, the symptoms won't be like before the symptoms comes, even some people there is no symptoms, but still they have the infectivity, like they spread the virus among the public. So
Mhm.
this is the reason, toughest reason for the like a government sector and even the health industry to contain the virus in the initial stages. See,
Ah,
everybody went into initial lockdown. So we all thought, okay, we are going to come out of it after this lockdown because we are like isolating the people who got affected by this disease. Then we are like doing a like contact isolation and everything we are doing, we are all hoping that okay, we are going to come out. We are all very wise, and we did the lockdown initially, so we are going to come out of it, not like other countries. Why we fail? Because of this only. Because we miss a lot of people with no symptoms. They spread the disease.
Yeah.
Obviously, it's extremely difficult to manage this because of this only.
Okay. So, doctor, having spoken about that this virus is spreading and we do not know, people might actually have symptoms or not, I think this is a very important question, which is regarding the masks. So, what is the right kind of mask to wear?
Okay.
There,
Sorry, I thought you give me a minute. I'll just take the mask and come. I thought we have to keep it here. 1 second.
all right. That's all right, doctor. So I'm sure participants, we all know that there are so many different types of masks that are available in market today. And all these masks, there's so many decorative masks, designer masks, N95 masks with probably openings in them, or cloth masks that can be recycled and worn, and so many different types of masks. So I'm sure all of us have this question within us, that what is the right kind of mask? And that is why doctor, I'm placing this question to you.
Yeah. Perfect question, Francis. See, initially when the pandemic happens, even in the US, what the government advised the public is wear any mask. Even you just like tie the handkerchief in your face and go, that's fine. Don't try to buy the N95 or a surgical mask. That's advice given by the government of US in the initial stages also. So we also follow the same because we all feel that okay, wearing the mask is adequate. Even frankly speaking, even as a medical professional, I never saw N95 mask before this pandemic. I don't even know what is N95 mask before the pandemic as a medical profession. Like mask is just a surgical thing what we use during the surgery. That's what we know.
Okay.
So, but when after this pandemic, we went through all the literature and about the mask, and we educated ourselves a lot about this mask. Then only we realized this cloth mask what we use have no role in this pandemic because it won't prevent any virus entry. It allows the virus entry freely without any problem. You got the point? So
yes.
the cloth mask is obsolete. You have to understand this.
Okay. All right. Okay,
So,
doctor.
okay, what is the next level mask which you have? See, everybody are using cloth masks. There are a lot of companies, they come up with a lot of new designs and it become a fashion to wear a fashionable mask nowadays. The next trend is the fashion mask. Okay,
Yeah.
but you have to understand, you can use it like a primary layer so that other masks won't irritate you. Over this mask, like the cloth mask, if you wear other mask, it's little comfortable to you. You can use that way. It's not the only mask. If you're going to use only that mask, it's not going to be useful. So what is the next mask available? This is called surgical mask. Okay. This surgical mask, we normally use it during the surgery time. And usually, like there will be a hard surface here. You have to fold it this way and keep it like this. Okay. This mask protects 60% of the viruses. Okay, this is also not 100% protection, but this protects 60%. Okay, so what is the best protective mask is that N95 mask. Okay, this is called N95 mask. Okay, this N95 mask, you see, wearing a mask also matters a lot. Okay, so N95 mask, when you're wearing this way, make sure, I'm sorry, I'm wearing an AirPod, I can't compromise the AirPod. So wearing a mask, so make sure that all the margins are properly, like sit over your face, it's tight, airtight. Some N95 mask comes in adjustments, like you can tighten the mask. Make sure that it's airtight. The idea of wearing a mask should be airtight. It's not for your comfort, it is for preventing the virus. You have to understand that. See, I do agree, wearing a mask is not an easy task in the initial stages. So, but definitely mask won't harm you by any way. It won't reduces your oxygen saturation. It won't reduces any of your vital parameters. If at all this that is true. A lot of WhatsApp messages have come saying that the people faint after the exercise. People do so don't wear a mask during the exercise. All those a lot of critical messages came through the WhatsApp. That's not true. If at all something should have happened, it has to happen to us during the surgery. See, we wear this N95 mask. Over that, we wear the surgical mask. Over that, we wear the face shield, and that all the complete PPE kit.
Okay.
Okay, wearing that mask and operating for 2 hours, 3 hours without removing the mask by any way, then if problem should have happened means, how the liposuction and all, we do liposuction, all the, it's a
Yes.
little extensive procedure like exercise only. We
Yeah.
do it for 1.5 2 hours without any issues wearing the mask. And even recently I posted a video on my Facebook, checking my pulse oximeter values immediately after the surgery,
Okay.
whether it's completely normal. It's not only, see, just to prove the public I did it, but I know that it is a normal thing.
Okay.
Okay, so you have to at least use N95 mask. Okay, if at all, if you're not using N95 mask, go for a surgical mask.
Okay. Thank you,
Okay,
doctor.
and other mask, you're all aware, most of the people are aware with the valve here.
Mm-hmm.
Okay, it might be comfortable to you because when you breathe, air will go out and come in, but
Mm-hmm.
it is very dangerous for the person opposite to you,
Okay. Okay.
because
Because it's going to
yeah,
expose yeah, the
yeah,
germs
what
are
happens
very
is,
good.
yeah, correct. This is see, when you're wearing other mask, that air will escape in all the route. Okay,
Mm-hmm.
but when you're wearing this kind of a mask, air will escape only through this face alone.
Mm-hmm.
So if you have a disease, concentrated viral load will come out of this space and directly hit the other person.
Mm-hmm.
Concentrated viral load will come through this small space and directly hit the person opposite. So if other person is wearing this mask, please be aware that you're wearing a mask properly and you're going away from it. Okay, understand this. Okay,
Mm-hmm.
so this mask. Another thing about the mask, commonest mistake, I posted a lot of my social media posts also. Commonest mistake, what we do is, when we wanting to talk to somebody, we just remove the mask and talk.
Yes.
Okay, till that time they'll be wearing a mask. As soon as we ask some questions, doctor, 1 minute, doctor, like that, they'll remove the mask and keep talking. Okay, that only time when they're supposed to wear a mask is when they talk or when they sneeze. Like, even it's proven that when the person talking loudly, that chances of spread will be so much. So that when people are going for a meetings and other, even if you see a lot of the like the public meetings, gatherings, the person who is speaking removing the mask and talking to the public, that is a very very wrong thing. It has to change. See, everybody knows their face, even the political party members, leaders, when they're talking, no, it's like 4 5 people, other people are wearing the mask. The person who talks remove the mask. That's also very risky, because loud talking will spread the virus faster. So you have to understand, not only coughing, sneezing, this loud talking and the speaking to others also matters a lot. During that time only you need to wear a mask. One more thing about the mask is, when you wear a mask like this, the outer surface of the mask, you have to potentially consider that is infectious. For example, you're using the mask and going out, and you see, when you're going out and you're talking to somebody, that person might have like asymptomatic carrier. He accidentally, mask came out and that particles coming and sitting here. Okay, so what we do, we feel that, okay, mask is not proper, okay, adjust it like this.
Ah,
We
yeah.
touch this surface.
Yeah.
Okay,
So,
you
yeah.
have to understand, as soon as you touch the surface, you have to go and clean your hand.
Hands.
Otherwise, how you have to adjust the mask is, you can go inside the area. Okay,
Okay.
like, if it is like this, use the finger and try to adjust this way and this way. Don't
Okay.
touch the outer surface. This is a new mask, so I'm, for the demonstration, I'm touching everywhere. So
Okay.
don't worry, nobody's there here, so I can do it. One person asked in other seminar, doctor, you yourself is not wearing
Oh,
mask. Because that is nobody is here to wear the mask. So this concept should clear. Once you touch the outer surface, your finger has to, like, you feel something abnormal in your finger, you have to immediately go to the that sanitizer, and you have to clean your hand nicely or wash with soap and water. That is very very important.
okay.
So these are all same way in workplace. Wearing a mask for a longer time is extremely difficult. So what we can do is, along with the face mask, you can put a face shield also, so that when accidentally mask comes down, or like without your knowledge, sometimes long hours of working, 8 hours, you don't even know where your mask. So if you have a face shield, So if the mistake happens, the face shield also will protect you from this kind of office spaces. Maintaining the space as well as two-level protections are always better in this case than
Okay, that is extremely insightful, doctor, and I think it's very, very important and not most appropriate masks. So I think this is very important from now on. That is one thing. We already have a couple of questions that are come up from our participants, doctor. So I'd be taking them in between. So I'm going to take one question from one Divya. She has been in home quarantine for 2 months and has tested negative 2 times. Now one of her nostrils is blocked and her bowel movement isn't good. Is this because of COVID?
See, the problem with the COVID is, why the symptoms are happening in COVID. Okay, the COVID virus enter into the body. First, it's in the throat, then enter into the lungs, and liver, and the heart, intestines, and all the places. And what it does is, when it sits in these places, our body will send a messenger cells to clear the virus. Okay, so a lot of cytokines and a lot of other messenger cells to attack the virus goes to the viral area where is the virus situated. Okay, so what now it not only attacks the virus, it attacks the nearby normal cells also. Okay, for example, you fell down somewhere, there is an injury. Why there is a swelling happening? The same principle. Okay, so it to correct the injured area, body sends something. So along with the injured area correction, it affects the normal cells also. So that, so people have to understand what is inflammation. This is what inflammation in the lungs, heart, and every body parts is affected.
Okay.
So the still the COVID-19 virus is not fully understood virus, but what we are seeing is lot of complaints like this happening in a lot of people because the inflammation what that body cells created in these muscles and that other organs are not subsiding even months together. 2 months, 3 months, they have body pain, joint pain. Some people they have bowel disturbances. Some people they have a like cardiac muscle issues, like cardiomyopathy, and all the muscle, not only lungs, every other body parts are getting affected by the COVID-19 virus. That because of the inflammation, not because directly because of the virus, it's because of the inflammation produced by our own body.
Okay.
You understand that? So this inflammation, see, people say that steroids, dexamethasone will help in this kind of a prolonged inflammation. Small dose of dexamethasone will help. Better let her meet her physician and discuss with her. Sometimes one more thing is what happens is for her, because of the lot of medicine intake, lot of this because of this viral illness, the normal gut flora might have altered. So she might be needing a probiotic also along with the other issues. The probiotic might help her along with let her meet the physician. Probably they'll put her on a very small dose so that or to, if you want to find out whether I already affected by COVID or not, okay, that is the only reason you need to do the test. Okay, so why we need to do the test? If it is, example, you got some symptoms, you feel that the symptoms are related to COVID. Say example, only cold and cough, why you want to go for the test? This time, whatever the cold, cough, and whatever symptoms, better to do a COVID test to rule out, because it tends to progress to the other organs, so that we'll be vigilant and we'll be safeguarding ourselves. Okay, whether our pulse oximeter values are coming down, or like our oxygen saturation falls down, so we need to go to the hospital early. At least we need to protect us from the dangerous effect of the COVID-19. That's the only reason we need to check. the COVID. That is the
Okay.
only confirmatory test is the RT-PCR test only.
Okay.
Okay, the PCR test only confirmatory. That is the antigen, which detects the antigen. If it comes positive, definitely it is positive. Okay, very very rare to see a false positive unless the lab is doing absolutely the mixing the samples or other things. So
Okay.
RT-PCR only confirmatory. False negative might happen because the taking the sample might not be very good because they have to take a nose swab and the throat swab. Sometimes reaching the throat end of the throat and taking the swab is little difficult for the personnel. So the false negatives can happen, but false positives are extremely rare.
Okay. Okay, doctor. That is. So we have actually a lot of questions dropping in. So yeah. So there is a pulse oximeter that shows different values for different finger varying from 93 to 95. Sometimes I get 88 also. What is the right method or right finger? This question
They have
is.
to change the pulse oximeter. Very simple. See, the pulse ox is varying. A lot of companies are there. Even sometimes it happens. Like even the same batch, one pulse oximeter won't work properly. So this is a finger pulse oximeter which normally everybody uses nowadays. So
Okay.
like usually the values has to be above 96,
Okay.
96, 97, 98. That's not accepted. Up to
Okay.
99, it usually 100% it won't show to most of the people unless otherwise you keep oxygen in your mouth, in your face. Keeping that value between 96 to 98, you're perfectly all right.
Mhm.
But the problem why we are checking the pulse oximeter often is something called silent hypoxia.
Okay.
Okay, hypoxia means blood oxygen level is coming down. That's called hypoxia in our terms. Okay, medical term.
Mhm.
So what is silent hypoxia means the people suffered from COVID, but they're not showing any symptoms. But without their knowledge, the lung is getting affected like progressively. They don't
Mhm.
have even any symptoms because body get used to that. For example, 10% of the lung involved for 1 or 2 days. Body used to that. Again, 20% lung involved. Body become accustomed to the 20% involvement, so it cope up with the remaining lungs. So it keep moving. Like one point it can't cope up, suddenly they collapse and they'll develop breathlessness and immediately they go. That time only difficult to treat the person.
Mhm.
So that is the reason we say 40-meter walking test. Okay,
Mhm.
you walk 40 meters inside your house or wherever and check the pulse oximeter after that. That is called little stress induced, like after this minimal exertion, how is your pulse oximeter? When
Mhm.
you put the pulse oximeter, usually here what it shows me, it will take some time initially. It will seem some pulse oximeter have a waveform. It shows 88 and 99 for me. So 99 is the saturation, 88 is the pulse of mine. Okay,
Okay.
it's pretty normal. So if you keep checking, like after the 40-meter walking test, if it shows less than 95, better to check it. Better to check your pulse oximeter first, whether it's a normal pulse oximeter, it's working pulse oximeter, not working, or else better to meet a doctor and get the guidance from the doctor because they might do a CT scan chest to find out whether the lung involvement is there. Because now CT scan, like how that RT-PCR tests, even before the RT-PCR, sometimes even RT-PCR negative cases, early chest X-ray shows the lung involvement. A lot of people they detect the COVID infection by doing a CT scan chest nowadays than the RT-PCR. So when there is a pulse oximeter value low, they'll do a CT scan to find out how many percent of the lung involved, and immediately they'll shift you to the hospital and they'll start giving oxygen.
Okay.
Okay, so only they need to find out early. So better to have a pulse oximeter in every household. And
Okay.
89, 90. See, it happens to my father also. I send the pulse oximeter to my hometown, and initially my father's pulse oximeter values always shows 89, 90 something and all. Then I asked them to change the pulse oximeter. Then like it worked well.
Okay.
And same way, the cleaning the solution also matters. Like
Mm.
some people they clean it with alcohol, or that solution also sometimes alter the pulse oximeter value. That's what I found in my father's case. One
Okay.
more thing is it works with the color of the nail bed. Okay, if you wear a nail polish and put this one, it won't work.
Okay.
Okay, if the red color nail polish, always it shows 99 only. If it's blue color, always it shows 30, 40 only. You gotta understand that.
Okay. Okay. Thank you, doctor. And we actually have a lot of coming, asking about reinfection of COVID. So, but before that, I think I would like you to answer something about herd immunity and how is that some number of cases in certain countries are decreasing without actually a vaccine having come out. Uh,
See, we'll start with their question itself because they're all ready wanting to know reinfection. See, initially I told that it's a coronavirus. Okay, out of 7 coronavirus type, okay, this is the last one, seventh one. First four coronaviruses, everybody in this world got sometimes in their life,
mm,
right? Common cold or something like that.
mm,
Like common cold and cough, and like that is the coronavirus commonly does. Okay. See, if you get a common cold, how long you are getting the immunity against the common cold? Some people even within 2 months you get twice.
yeah.
Okay, some people 6 months they won't get it again. Another 6 months they'll get cold again. Okay, this is the same coronavirus family, same virus. What will you expect? Okay, so maximum 3 months or 2 months you'll
Mm,
have the immunity against the coronavirus. Okay, now after 6 7 months of pandemic, now people started noticing the reinfection. Even in Andhra, they found 3 cases. I think Maharashtra 1 case, and in I think Hong Kong or China, they found one more case. So reinfection start emerging now. Okay,
mm,
so this is how the reinfection tends to. This is a problem with the vaccine development also. See, even the real infection produce immunity only for 3 months or 4 months. If the vaccine they are going to mimic like an infection, that infection, how long it is going to, sustain the antibody level in the body? Okay, that's the biggest question in any, as a doctor in any vaccine. I want that answer only, but it's very difficult to give that answer now because they need to finish the phase 3 trials fully to understand the how long that immunity lasts. Okay, see what is herd immunity? Herd immunity means in a circle there's a 100 people are you're keeping inside a circle, and in 100 people, if the antibody levels are high for 60 people, minimum 60 people needed to get a herd immunity, so that other 30 40 people inside the round will be protected against the virus. That is called herd immunity. To acquire a herd immunity, at least 60% of the population have to had a virus.
mm,
Consider India. Okay, the rate of the infection happening in India is so much. Okay, rate of new infection occurring in India also so much. So what happens? One person get corrected, other person infected with the virus, so it's very difficult to. And as I said, that the viral antibody levels also don't stay there for long.
mhm.
Okay,
Yeah.
so attaining the herd immunity in the community here is extremely difficult. Understand that herd immunity is completely ruled out in Indian scenario, and
Mhm.
most of the countries also they agree that herd immunity is not helping them.
Okay.
Okay, so in fact the question what you asked, other countries the numbers are coming down. That means Italy and all, they saw a worst in their initial phase. Now they follow all the precautions properly so that immunity levels, like it's not immunity actually. It is because the precautions they are reducing the number of infections, new infections, so that the death rate is low, so that curve has come down. That's what I can say. I don't say it's a herd immunity. So
Mm,
only when the vaccine comes, if you vaccinate so widely and fastly, if you cover 60 to 70% of the population, and that vaccine efficacy should be 100%.
mhm. Yeah.
Okay, then only that immunity will spread around, and then only we can come out of the infection, come out of this COVID-19 situation. But these two parts are extremely difficult.
Mm,
100% effective vaccines are difficult. Say
mhm,
example, usually vaccines say that if it is 80% is really good vaccine. That
mhm.
means you have to immunize almost 80% of the population so that to get out of this infection.
Yeah.
So vaccine, even vaccine comes, we have to understand clearly. All the people who are watching this program have to understand clearly. We have to follow social distancing, hand cleansing, and the mask wearing for another 1 or 2 years. Till that time, if you're not following, Nobody can help you. If you get the example, if you get the infection, if the asymptomatic patient coming out without any problem, no issues. But the problem is this, as that girl said, the infections, like that, the inflammation process stays there in the body for a longer time. Even one of the dentists died recently after testing COVID negative. She left home and then she developed lung complications and she died. Young dentist, 33, 34 years dentist. So don't think the COVID negative test says that, okay, my problem is over. No, the inflammation going to stay in the body for a longer time.
Yes. Thank you, doctor. And we have a question from one Mr. Abhishek. How long will the asymptomatic person be able to spread the COVID virus?
It's like the same, like how the how many days you isolate a patient after the reduction. Okay, minimum 10 days to 14 days. Okay, after 14 days the virus will automatically die. Okay, only the 10 to 14 days they used to spread the virus. So usually we say something called R naught. That means one person, how many person, the infected one person, how many person that infected person is infecting others. Yeah. Usually that R naught is in COVID-19 it is 2.5. Okay, so the problem is when the asymptomatic this person goes for a super spreader events like a marriage, some like sports events, some like function with a crowded place or religious ceremonies, then it becomes one person is infecting 40-50 people at a time. Okay, so only that we have to avoid going to the public gatherings in the crowded places, like to avoid that spread, the super spreader events. So that's what government was so much till today they are kind of like stopping all these events. Now they feel that even when the economy is falling so much, even a lot of people going for a suicide and a lot of other issues, they want to balance it. Now only like trying to open doesn't mean that we are coming out of the situation. They are trying to balance the situation and trying to balance the economy as well as the virus. So that's what people have to understand.
Yes. Yes, thank you, doctor. So some people have a really interesting question. It's anonymous. The COVID has been ravaging the entire world, but some people seem to be in denial of the seriousness of the issue. Or is it true that we are overreacting? Bluntly speaking, is COVID a myth or real?
See, we are all doctors. Now, not only me, all over the world, doctors are trying to understand this COVID. See, the virus is seen in a microscope clearly. Yeah. Definitely, it is not a bogus one. Okay, first you understand that. RT-PCR, the antigen we picking out means there is something there. Okay, and other thing, even my staff, one of my staff, and came and said, "Doctor, I went to one of my friend's place. She's not following anything. She's touching. She's having a cake shop, and she's having 4 workers not wearing masks. She immediately goes back and touches the kids." I'm just thinking, are we overdoing? Or because all my staff, they listen to my speeches continuously and they follow most of the things. So are we overdoing or whether she is underdoing? Okay. Within 2 days, news came that family, husband, wife, kid, mother-in-law, father-in-law, sister-in-law, everybody are positive.
Oh God.
You got it? Okay. So, like following the precautions doesn't mean that we don't get the infection. Chances are very remote. Okay, so say example, if you follow everything, chance of getting an infection is still there. Like it's very extremely difficult to completely sterilize your place. But if you're following the mask wearing and the social distancing and the hand washing properly, the chance of getting infection is only 5%. Okay. If you're not following, 95% chance that you'll get the infection. What do you want to take? Obviously. Yes, we all get bored of wearing a mask, and obviously, like sometimes we forget. And make sure that, see, always I tell most of the interviews, each and every person you meet outside, you have to consider they are positive. Yeah. Okay, then only you follow the instructions properly. You use this thing that this is my friend, this is my close friend, he doesn't have the infection. If you think that way and take the selfie with him and going partying with him, obviously you're not safe. But understand that. guys, we had a good life till today. We went partying and we went, like every function we had cinema, we went to cinemas. Now understand, we are in the serious situation. So think about some people in your family getting the infection. They are going for a dreadful situations. Whether see, that is the reason is we only understand that we
Yeah.
carry the infection to home and we are making them sick. Even see, it's not leaving any youngsters also from 20 to 40, 50, 60, any age, the mortality we are seeing. So
Mhm.
still doctors are not understanding the disease. See, I do understand. See, all these lot of good things are there in our native medicines like Kabasura Kudineer,
Mhm.
homeopathy medicines are giving. Try everything. Okay, nothing wrong in trying everything. Every specialty has some good thing. Like homeopathy works on virus as well, and Kavasura Pudinir, people see a lot of good cure from the Kavasura Pudinir. Follow
Mhm.
everything, but same time, still nobody knows about the virus. Wear the mask properly and go out.
Mhm.
In fact, when we are seeing the patient, we wear a N95 mask. For that, we wear a surgical mask. Then we put a face shield. Then only we see the OP now. It's so
Okay.
annoying for us also.
Mhm.
Because we are annoyed, you should not carry the infection home and create problem at home as well as the see. If everybody follows this precautions properly, how many the discipline sets in properly in the community, we
Yeah.
can throw the second third wave easily and come out of the situation faster. If you want
Yeah.
to reduce the count in your area, it's your responsibility to follow every precaution, and you make sure that people around you following everything properly, and teach at least 4 5 people in a day about this mask wearing and hand sanitation technique, why they need to do it. Unless otherwise you spread this information to the root level, extremely difficult to come out of the situation. Today Italy has 1,000 cases, till 1,200 cases, and 1 or 2 deaths every day. Still it is happening. But idea of why we want to do all the precaution is we want to reduce the death rate. And when you're coming out of the situation, we should not lose half of our population. People have to understand.
Okay. Thank you, doctor. We have a question from Dr. Farzana. I'm a doctor and I got infected last month with COVID. I'm planning to restart my OPD. Am I putting myself again into risk of reinfection? Could you explain in a few words, doctor?
Actually, you have to think other way, Fazana. You have to think, am I going to infect people coming to my
Yeah.
clinic? That is your first, should be the first question. Okay. So,
Yeah.
see, after 15 days, keep even 1 week extra. Okay. Because still the COVID, every day people keep telling the different things. Okay. 14 days, you keep 3 weeks. After 3 weeks, your infectivity is definitely nil. But still, you inform your patients. Okay, you have to inform your patients. I got treated for COVID, 3 weeks over, and I'm sitting for a consultation. Okay, you might lose some practice. That's fine, but still you have to inform. That is your responsibility.
Yes.
Okay, that the decision taking the decision is patient. Okay, whether to come and meet you for the consultation or not, that is that decision. As I said, we are going to live with this coronavirus for another 1 year or 2 year. We don't know. Even the vaccine comes, all these precautions you need to follow.
Mm.
The mistake what next level you're going to see after vaccine comes, we all like throw the mask and trying to roam around, then all the reinfections will keep occurring. People have to
Mhm.
understand after the immunization the starts also, people have to follow the mask and everything properly for another 6 months to 1 year. We don't know according to the that time only we know that situation. So when you're wearing, see, since it's going to be there for 1 or 2 years, are you going to stop practicing? No, we need to practice. Okay, even I'm in a cosmetic sector, I can stop practicing and sit at home, no problem. But we need to survive. Okay, so we need to practice. Reduce your practice load,
Mhm.
and same time follow all the precautions. As I said, my practice, I use N95 over the surgical mask, then a face shield and a cap, and I wear a theater dress for the OP. Once that OP over, I'll dispose the theater dress to the I'll just send it for the wash. And then the consultation room, every day we fumigate. We
Mhm.
like we sterilize the room every day after the consultation. So
Okay.
if you follow all these kind of extreme precautions, definitely you won't get reinfected. In fact, in your case, already antibody levels are going to be there. So obviously you can definitely practice boldly, but follow all the precautions so that other people won't get scared. See, you won't infect, but they get scared if you're not following the precautions at this stage.
Mhm.
They are all lay people, by the way. Still, they are afraid to see the COVID positive patients.
Positive patients. Okay. Thank you, doctor. So we have a question. Immune system present in our body produces antibodies against every foreign particle. So what about COVID-19 and in its case?
Obviously, see, the antibodies are produced against the COVID after the infection. But the problem with the antibodies are even now, recently one article came saying that if you are not symptomatic, you are asymptomatic, or you have only mild symptoms of the COVID, antibodies stay there in your body shorter time. If you are went into a serious COVID in the infection and you come out of the situation, your antibody stays there for longer. So even we started seeing the reinfection. So antibodies are developing in any infection. Same way the COVID also we are seeing the antibodies, but it's short-lived. So only we need to be careful. Even the people already become positive, follow all the precautions. Don't be freaky and remove all the mask and roam around since you got the infection, because you have to follow all those things for till we are coming out of the situation.
Okay. Uh, the change is hard for all the people, and this COVID situation has changed so many things too suddenly. What should we do for us to truly make peace with this fact and without losing our mind because of the changing situation? Simply put, how do we adjust and change this into positively thinking beyond basic things like hygiene, distancing, and what are the changes we should make in our general thinking?
See, first accept the reality. Okay, accepting the reality is the first thing. Still we think, okay, tomorrow it will be over, day after tomorrow it will be over, kind of. No, it is going to be there for 1.5 to 2 years. Okay,
Okay.
develop a hobby inside the house or inside wherever you're working. See, you're working from home means you need to have some kind. You can't work 24/7 at home also. So develop some hobbies in which with by social distancing and all the precautions you can follow, still that hobby can be activated. See example, I developed, I love to read, but off late I started doing a lot of so learning a lot of apps like iMovie or Adobe Pro, and all my travel. I traveled a lot in the last 10 years. Vasudha might be knowing. So I want to make a video out of it, and all the travel experiences, everything. I'm trying to edit on my own. I'm trying to uh, post in my YouTube channel. Like, and educating you guys. And see, the COVID, I'm not a specialist in the infectious disease, but I want to learn about, as a doctor, I want to learn about this infection to spread the knowledge about the to the public, so that the whole community will be benefited. That's the idea I take this topic today also. So I work on this. Though I see patients, normally I do 30 to 40 surgeries per month easily. Now I reduced to 12 surgeries, and I know, like, I work only half a day. Like, so these are all just surviving things. As Jack Ma told in 2020, 21, if you're alive, that is the biggest earning of that year. Like, that's what you have to understand. So be cautious. Don't get annoyed with this lockdown thing, because you have to follow everything to survive this year, to come out of the next year. So develop like hobbies, and try to cope with, accept the reality. As a family, try to evolve from that, and follow things. Be happy, do video calls, like do con call, conferencing, everything. Now it's very easy. So think about the earlier pandemics when the lockdown means nothing.
True, true, doctor. We have a question from one Mr. Kesavan. Is the antigen itself available for the public? Can't we take a test at home? Is it simple? Is it a simple indicator test kit?
See, the till in India, it's a lab test only. Not that home kits are not available. As my knowledge, home kits are not available.
Okay.
See, the K7 has to understand two things. Antigen is that RT-PCR.
Mhm.
Antigen is a viral particle.
Mhm.
An antibody is our body secretes something against that antigen.
Mhm.
Okay, so we can detect the antibody also, we can detect antigen also. But COVID antibody test, though it is done for the like a company before they entering into the like job, they are doing antibody testing as a mass.
Mhm.
But the confirmatory thing is only RT-PCR. Okay, so this antibody thing still not very much popular, because one antibody developed in the acute infection. When there is infection is happening, one antibody will level rise. One and IgG and IgM is there. IgM level will rise in the initial phase of the infection, and when IgG levels are high, that means that you had an infection, and so now that IgG levels are high. So
Okay.
people wanting to do, because when the IgG levels are high, that means you already got infection. So I might be safe. Like, what is the point? The chance of reinfection is going to be there in another 2 months. What is the point of doing an antibody test? Okay, so don't waste your money. Just be cool, follow all the precautions, and be safe. Don't try to overact.
Okay. Okay, doctor. How about stress levels? Does that affect my chances of surviving COVID? Does worrying about COVID make it worse for a person infected, or does it not have much impact?
100% it increases the chances of affection, stress level. See, the more than this, why stress levels are important is your immunity will comes down during that time, and your inflammation, once the virus, even the virus enter into the body, the inflammation levels are going to be very high if you're very much stressed.
Mhm.
Okay, so only I always advise them to do yoga, pranayama. Like
Mhm.
pranayama and all, it try to balance the energy in the body, so that what is the adequate inflammation has to happen, but it should not over inflammation, so that body other normal tissues should not get affected. Okay, so that pranayama, what we do alternate nose breathing.
Yeah.
So we try to balance the male and female energy in the right side left side brain. Okay,
Okay.
they're all proven this in a scientific way, like measuring the inflammatory markers before pranayama, after pranayama, how much it makes that inflammatory markers comes down. All these are scientifically proven. It is
Okay.
not something like we are telling like blindly. So try to do pranayama regularly, do yoga regularly, meditation. These all the things. See, try to see, we have a lot of time. Earlier I used to say, see, if I get a time, I'll be learning meditation and try to do meditation a lot. Like, when we have time, try to use it. And same way, we say that if you give me time, like if I have adequate time, I lose my weight and I'll be fit like anything. Only problem is my work schedule, my work hours. Now you have a lot of time. Are we doing it? That is our mindset mentality. Okay, so be happy, be relaxed, stress free. Like, we don't know whether we live next year or not. So try to do, see, you should not regret, like whatever you want to do in your life, do it now. The sense, like speak with your, like friend we haven't spoken for a long time. Try to be, like optimistic and try to do things which makes you happy.
Yes. Yes, doctor. There's another interesting question, one that's got to do with the masks. There's a participant who's asked us, how many times can we use the same N95 mask? That is, if I've used it once, how frequently can I use it?
Actually, 5 times you can use the N95 mask.
Okay.
5 times. But like, even without you want to dispose, automatically this threads and all come away, and other mask usually like it tear away after 4 5 times, it will tear away. So 5 times you can use it if you're using for a longer time. And see, better way is wear one more like normal mask, which is washable mask,
Mhm.
like over the N95, so that when you come back, see, what I normally advise is I keep 4 5 N95 masks. Like I'll put it like in a hanger every day. I use that one after 5 days. Like
Okay.
in the sunlight. Okay, sunlight. I'll keep the one thing hang there, because we can't sterilize it. I have a sterilizer. I don't know whether how much it is effective. It's called ozone sterilizer.
Okay.
I'll put it inside the thing and keep it for 20 minutes, and they say it is effective. But I don't
Okay.
know how much is effective against coronavirus. Just like our at least something I want to do. So same way, every rotation you can use the mask, and over that keep some cloth mask in it, so you can wash the cloth mask every day. Okay,
Okay.
that's one way to manage the thing.
Okay. Okay. Thank you,
Surgical
doctor.
mask disposable. Surgical
Disposable.
mask
Yes.
only one use.
One time. Okay. Okay,
one
doctor.
time.
Okay. So that is one. And there is another question by Manisha Nair. My dad's O2 saturation level is always around 94 to 95. He is around 60 years old. From the past 1 month, although he has had no COVID symptoms, neither was he tested positive. Is it something to be worried about? Could you please guide us?
See, a lot of people, they already have lung issues. Like their basal saturation itself 94, 95. Okay, it will be there for a long time. Even on my apartment, one person has a lung already got infected, and they did a lot of procedures in the lung. So his
Mhm,
saturation is always 93 to 95 only.
mhm,
Okay, that is normal for their body. Like their body is already accustomed to it. So when you see a drop more than 3 to 4 in your routine, like pulse oximeter value, then you need to worry. See, if his value is from beginning 95 or 94 only, need not worry. Okay, you need to be vigilant. He is in the risk when you get a COVID. If like the saturation drops, immediately he going for a respiratory issues faster. So you
mhm.
need to be careful. But some people, like because of the various other comorbid factors, their lung issues, the pulse oximeter value will be low only. So
Mhm.
meet a physician, get the opinion from him. Don't like just my words. I haven't seen the person in the person. So better to get evaluated by the doctor also. But that is quite normal if it is already existing value is the same.
Mhm. So, doctor, about this N95 mask, you had mentioned that we can use it 5 times, repeatedly 5 times. Is there any specific number of hours that you'd prescribe for using that mask once or twice? Or yeah, like
See,
because
really
I
asking, I
carry.
don't know the times. Really asking, I don't know because I use like 8 to 9 hours in a day. So I use it for 5 days. Okay.
Okay.
uh, we need to see the literature. See, don't go into the very intricate details of this. Okay,
Okay.
wearing the mask is important. Like
Okay.
you yourself know that mask is not wearable after some time.
Yeah.
Like it smells and it sweats. So
Yes.
throw it away. Okay,
Okay.
so this is it's not going to like change the particle entering and all, but it becomes unusable for sure after five times or 6 times. So
Mhm.
try to throw away. I don't know the answer how many hours, but you yourself know that mask is not usable.
Usable, yes. Okay, doctor. Now coming to something more specific, would it be sensible to go in for a cosmetic surgery right now? And for example, if I want to get a nose correction done or a lip correction or liposuction, what should I do, doctor?
Definitely no.
Okay.
The thing is, see, we do cosmetic surgeries now also. What I do is I do body surgeries. Like the male breast correction, tummy tucks, breast surgeries, and breast implants. All those things I do because all those surgeries are very short surgeries, 1.5 2 hours. Like I finish the surgeries and come out. So
Okay.
I follow all the precautions. The whole team will be following the PPE. We do COVID test for the patients. Sometimes it's little major. We do a CT scan chest also before the surgery. We'll
Mhm.
take the patient for surgery. Like why everybody wanting to come for surgery now is because they have time now.
Fine. Yeah.
Okay, that's the only reason they're asking me. So sometimes if it is safer, we do it.
Mhm.
But if you are my like a relative, I definitely say don't come. But sometimes we have to weigh the risk and that like they have the benefits now. Like we have to outweigh weigh the risk and the benefits. So if the
Okay.
benefits are more, sometimes we say yes. So no surgeries, definitely no. Better not to go for it. Any facial surgeries. In
Mhm.
fact, I even feel hair transplant is not safer at this stage.
Okay.
Like because 8 9 6 7 hours, like around the face. Obviously, a lot of mistakes happen during the surgery. Patient, my mask will comes down, your mask will goes down. If you are
Yeah.
asymptomatic, you transmit to patient, and if the patient is asymptomatic, though the test came negative, it
Mhm.
can 100% say that he's negative. Like a lot of false negative will be there. So if he's going to be the false negative person, then he also can infect the whole team, not only the doctor. The whole people around that the the theater will be getting affected. So not safer.
Not safe to go in for a treatment right now. It's not recommended by you. Okay,
Yeah.
doctor. So I get a headache or fever, and I've taken Dolo or some other medicine for 2 days, and I feel a little bit better now. But should I still go ahead and take a COVID test, or wait for some more days and see if I have a repeated fever, and or at what stage should I go in for a COVID test?
It's very difficult to answer only. See, if your family has a lot of people and elders are there at family, immediately go and get it tested, because you might need to isolate yourself.
Mm-hmm.
Okay, even you sent one question earlier. Even the skin rash is a sign of COVID. Okay, so nobody will think that skin rash will go and test for the COVID.
Mm-hmm.
Even the skin rash is a sign of COVID nowadays. So all age very non-specific symptoms we see nowadays. Obviously, if your family has a lot of people and you can't isolate yourself well, better to test. But
Okay.
like immediately you go and test, the results might not be positive. So third, fourth day only it will be 100% positive. So
Mm-hmm.
if you get the symptoms, isolate yourself and don't mingle with the family members. Wear the mask and properly isolate yourself. After 3 days, still the symptom persists, you go and give the COVID test. Or a lot of family members are there, you want to make sure that everything is safe, go and give a COVID test. Otherwise, not necessary.
Not necessary. Okay, doctor. So that you were talking about the skin rash symptoms and stuff like that. I actually have a question for you. Does having a skin disease increase my chance of getting COVID?
See, not really, because we lot of the skin issues we call it like atopic dermatitis.
Mhm.
Basically, the inflammatory process and the allergic process in the body. That's
Mhm.
what people have to understand.
Okay.
The chances of getting infection in these people is not high, but
Mhm.
if they get the infection, chances of body react to the infection will be more, inflammation will be more, the allergic reaction will be more. So the definitely chances of getting the infection is not more.
Mhm. Okay. Okay,
I hope
doctor.
I answered the question.
Yes, doctor. Yes. So, what are the effects on skin while wearing the mask for really long hours? A lot of people have issues with marks coming on their nose and on the other zones. How can we take care of that?
Actually, we are going to all the skin doctors going to face other different issue now, because earlier people come and ask, doctor, my body color is different, my face color is different. Try to do something for that. I want my body color in my face. Now they are going to come and say that my the mask covered area alone is a different color. The other face is different color. We are going to see a lot of different issues now.
Mhm.
See, it's going see very common, very the general, very logical thinking only. Going to sweat a lot if you're not in the AC room. Even if in the AC room, it sweats a lot. And the pressure, because the pressure, you might get the imprints of that mask, and sometimes it even wound the skin. So when you're wearing for a longer time, that area become numb also sometimes. So you don't even know that it's becoming injured, that skin becoming injured. So these are all the problems. So easily it can be managed. Apply good moisturizing cream and sunscreen completely over the face, so that it slips and it won't, like give a pressure over that area. And don't wear the mask more than 3 hours continuously. Go to a safer place and try to remove the mask, breathe, and try to, like moisturize that area, or apply the sunscreen over the whole face, because most of the sunscreen also have like some moisture nowadays. So it also have a little moisture effect. So apply the sunscreen and moisture nicely and come out. So because wearing more than 3-4 hours, it definitely injure the skin.
Okay.
So try to remove every 3 hours in a safer area where no people is there, and try to remove and at least breathe for some time, apply some creams and come on, wear it again. That's the only way we can prevent.
Okay. Thank you, doctor. And about we get a lot of grocery bags, postal covers, or sometimes we even order food. Is it necessary to disinfect these bags? And
See that even earlier studies say that plastics and the metal surfaces, it stays there for longer. So all our the grocery bags are plastic. Sometimes nowadays even plastic bags have come out again. So the thing is, we have to consider that potentially risky only. So then don't take it very lightly. Uh, say example, say you order a food from Swiggy. I'll give you an example how to manage it. You order
okay.
food from Swiggy. Okay, you're keeping the guy you haven't met, so kept it outside home and left.
Mhm.
We have to consider that guy is positive.
Okay.
First thing. So you
Mhm.
have to think that that person, that handle is positive, carrying the virus. So okay, hold the bag and come inside. Take the parcel out. Wash your hand first.
Okay.
Okay.
Mhm.
Then, if possible, open all the like that whatever you bought. Keep it in a other maybe if you can microwave it, and again wash the hand because you touched all this thing. Then eat it.
Okay.
Okay, if you can't even microwave, at least try to when you handle any like particles outside home, consider positive, consider that has a virus.
Virus. Okay.
See, you don't believe, sometimes I order from Swiggy. Before I eat the food, I should have washed 5 times my hand.
Okay.
Okay, see, it might not be, see, sometimes I think, am I overdoing? Okay, nothing wrong. If I overdo, that is fine. But if you get the infection, that is not fine.
Yes.
Okay,
Yes.
overdoing is always safer than
Not.
like be freaky in this
Yes.
situation.
Yes. Yes, doctor. And has has who WHO recommended any particular chemical for surface sanitation, such as 70% alcohol or any type of hand sanitizer that has been prescribed
Really, I don't have idea for about that amount and all.
amount?
Go
Okay.
for a like a very standard like hand sanitizer, like try to buy it from the medical shops, like don't buy in that all these grocery stores and all. Like it has to be medical grade thing, it will be better.
Okay.
you know
Okay.
all this earlier we called sterilium, and come with a lot of other new brands are coming, but it should be a medical grade. Try to
Mhm.
get it from a medical shop than getting it from a grocery stores.
Okay. And we have an interesting question, Doctor. What is the relationship between COVID and 5G radiation? This is from Rishika.
I don't have a clue. I think
Okay.
some article should have come, so only she's asking.
Asking.
I really don't have a clue. 5G radiation means that the mobile 4G,
Yeah,
5G.
yeah.
We
Has
still
that
have
got to
only
do
4G,
with
no?
here, but abroad and other places?
Abroad 5G, okay.
Yeah,
Okay. I
yeah.
don't have any clue.
That is okay. That is one thing. Uh, is body pain a symptom of COVID? And this is from Srinivasa Rao, doctor.
Okay, so see, body pain is a symptom of COVID for sure. Like usually, what are the symptoms? They might get cold,
Hmm.
sore throat, body pain, like difficulty in breathing, loss of smell, loss of taste. These are all the common symptoms what we see in the skin rashes nowadays. Some people they get a gastrointestinal symptoms like a loose motion and stomach upset. And like now today, what are symptoms you get, you have to consider it as a COVID unless otherwise proven.
Okay,
Still every day new symptoms are emerging, new things are coming. So if you're not normal, you are sick, consider COVID. Very simple.
okay, okay, doctor. And I mean, pretty much that was one of the questions from our participants as well. You've answered it. That is basically like apart from the symptoms like cold, fever, breathing problem, cough, or other things mentioned, are there other rare symptoms that you are aware of, doctor?
As I said, the skin rash itself is a new thing. Like it's a new thing. Even the fingers get affected, and like now, because see, my hand is a very moist hand. Like always people say I have very soft hand, but
Okay.
my hand becomes dry, and now I have to use a moisturizer for my hand. Okay, that is the situation now because so many times we use the alcohol-based rub, so it becomes dry. So that skin rash is different. Don't confuse that alcohol rub skin rash with other things. But usually now people say they see skin rashes in the fingers and the toes and the body. It starts with a like red kind of a thing. It's then prickly heat kind of a thing. All these things are kind of, as I said, no. Now we are following all the precautions. Getting a viral infection is extremely rare because we are wearing a mask, doing everything. Even other coronavirus should not come now because we are following everything properly. A whole community is doing it.
Okay.
Now, if you're getting something different from normal,
Mhm.
consider that is a COVID. That's what I'm trying to say. Okay, don't be okay. This is not COVID symptom. Nothing called it's not COVID symptoms, because every day doctors and scientists are emerging the new symptoms. So
Mhm.
it might be the first of you get the symptom, you know. So try to keep that as a symptom and try to be aware. Try to see online. Try to search online whether they have something similar, and try to get the information. And if doubt, meet the doctor and try to get the, you know, like if you see a lot of fear also there. See today, every day I feel I have sore throat.
Okay.
Okay, as soon as I get up in the morning, see that the fear also. Okay, whether I have, I keep, you know, like monitoring my body consciously, thinking that okay, whether I have COVID today,
Mhm.
because I'm seeing patients every day, so I need to think about it. You know, so everybody have the same fear. Not only you, doctors and everybody.
Mhm.
Be vigilant about your body and consciously monitor your body. If you're something different, try to contact the doctor.
Okay.
Don't self-medicate.
Okay. So we have a question from one Mr. Abhishek. I have seen a case where he had fever, cold, and jaundice, but when he was tested for COVID, it came negative. But after a week, his situation became a little bit more serious, and doctor prescribed to take HRCT scan. And doctor told that he is positive for COVID. So what do you think the doctor is HRCT is exact value? Where can we know about the COVID if the COVID test fails?
See, as I said, no initial stages when you take the test, COVID test, the swab, the virus might escape from the swab, so the results come negative.
Mhm.
As I said, if the results is negative, doesn't mean that you are negative. That's what you have to understand. So
Mhm.
if you have symptoms are very severe, strong suspicion, so only doctor did a HRCT. HRCT is a very very sensitive thing. The HRCT means high resolution CT scan. The
Yeah.
CT scan, they now they have scores up to 20 or 30, something like that. So they say the score, how many percentage of the lung is involved. Accordingly, they give a score.
Okay.
Initial days, the lung involvement is less, and after some time, lung involvement will be more. You know, one of my friend doctor, he twice tested negative, symptoms are persistent. Then they did a CT scan. CT scan shows that the lung involvement. Then they admitted that they got oxygen, other things. He's fine now. So the only thing is be vigilant and be suspicious in each and every case. What you're seeing is a COVID,
Mhm.
and try to rule out COVID by doing a HRCT. And now that almost like a COVID testing, CTs can also become part of the investigation.
Okay.
People have to understand.
Okay. So now it's like compulsory to do both the swab and the
For
scan.
most of the other cosmetic centers, one of my friend's cosmetic center, she does CT scan for all the patients along with the COVID test before the surgery. Then only it is confirmatory that the is negative.
Okay. Thank you, doctor. So so there are a lot of people because they wear the mask and they sweat really lot in that zone. Would that cause any rashes, acne, and it would that be able to cause the infection, COVID infection itself?
Definitely not. See, it's not like moist environment in this region doesn't matter. Doesn't mean that COVID will come and sit there. It can't survive in that area. People have
Okay.
to understand. See, we can tell all lame excuses to avoid the mask, but
Wearing, okay.
so we have, see, if acne comes also, we have to manage.
Well,
It doesn't mean that you have to remove the mask. Okay,
okay.
mask is mandatory. Whatever comes because of the mask, we need to manage it. Whatever the issues or rashes, we need to manage it. Understand that. Don't, you know, like our human mind, we try to choose the escape points. You know, like I get the acne, so I removed it. I can't tolerate, I can't breathe, so I removed it. You know, like this is
Uh-huh.
all escape points we search for. So
Mhm.
understand, it's just a habit, and you know, like it's just training ourselves to wear the mask. If you can't wear the mask for 10 minutes, wear it at home and try to train yourself. Then make it like a half an hour, make it like a 1 hour. When you're watching a TV, try to wear a mask and try to train yourself. It'll be easier when you go out of the office, because everybody going to move out, everybody going to go to the public and going to do the routine work after some time. So
Mhm.
you have to train yourself for the mask wearing, that culture, that discipline. Even UK, one of my cousin is working in Amazon, and you know, like that company, they have a bell system. Every 1 hour, three people are appointed to monitor whether everybody are sanitizing the hand. Every 1 hour when bell rings, the
Okay.
people they have to use a sanitizer, and then only they start using the going back to the work. Okay, that
Okay.
is a system followed in Amazon in UK. So
Okay.
it's very good to know that. So same way, wearing the mask also, you have to train yourself. Understand that.
All right. Thank you very much, Doctor. With that, we are actually come to the end of the session today, and I really think it has been a very important session. And the use of using the mask, sanitation, and there's this one thing that I'd like to ask, Doctor. Even though we use a lot of masks and sanitizer and everything, I would like to ask this as the last question. Like, how important is social distancing? Because a lot of people, even when I interact with them, they have a tendency either to remove their mask or come closer because they can't be heard. They like, so I would like you to expand a little bit on that. And
See, the 6 feet social distancing in Indian scenario is obviously difficult. Okay, both the person wearing the mask properly and communicating with each other is fine, even if the 6 feet is compromised.
okay.
Because you think about Indian scenario, 6 feet is absolutely not
Uh,
possible.
mhm.
So, okay, you can violate 3 feet or 4 feet. Don't be very close and try to talk. Okay, that's what
Okay.
I can say. One more thing, what we have missed is the vaccine. What is the
Yeah.
stage of this vaccine now?
Mhm.
Like there are three vaccines, like trials are promising in and around India. Even though those companies are doing testing in India also.
Mhm.
See, our Indian vaccine is something called Covaxin. It's from Bharat Biotech and ICMR, our Indian Council for Research, ICMR, our Indian association. It both are managing to get the Covaxin to the Indian community, but that is in phase 2 trials. Okay, phase 1 trial means they'll understand whether there is any side effect of the drug. Okay, they rule out the side effects in phase 1 trial. Phase 2 trial, they give it to a lot of one group of people and try to find out what are the symptoms, and how much antibodies are producing, how much immunogenicity is developing, all those in phase 2. Phase 3 only, they have a control group, and they have a like other group where that vaccines are administered, and they'll do a large number of groups. That takes a lot of time to that is a longer phase, like in the all three phases. Phase 3 is a longer phase. Okay, our Indian vaccine is still in phase 2, and other the vaccine, like AstraZeneca and Oxford together uses a viral vector based vaccine that's also entering into the phase 3, and other Novavax subunit vaccine, that's also entering into the phase 3. Okay, most of the vaccine companies are other. We don't know anything about the Russian vaccine, Chinese vaccine. They're still, like they are not revealing what exactly it is. Okay, so the phase 3, even the bio vaccines which entered phase 3, if at all everything is successful, we can get the vaccine end of the year or beginning of the next year. For implementing the vaccination, see, like polio vaccination and other vaccination, like it's all group of people, only kids, only, like a particular age group, like that we are giving till today. Okay, but this vaccination problem is all the community people have to get the vaccine.
Mhm.
It is not easy job. Okay, it takes easily from start of implementation almost takes 1.5 to 2 years easily in Indian scenario.
Mhm.
Okay, so don't expect, and same way as I said, it's a coronavirus family, only antibody stays that for a very shorter period. Even when the infection comes, antibody stays there for shorter period. Means what is the status of vaccine? Vaccine is artificially induced thing we are giving inside the body. Antibody, how long it is going to stay, nobody have idea. If it is going to be short lived, how many times you give a vaccine in a year? Is it practical? We don't know the answers for that. Understand that. So even vaccine comes, that is that your social distancing and masking is not a exception. You have to use it. Even vaccine comes. So this is going to be for another 1 year or 2 year. Mentally prepare yourself and like accept the reality. Go with the flow. We don't have
Okay.
much power to control the situation. Understand that.
Uh, okay. Okay. Thank you, Doctor. I'm just going to take one last question. Uh, I understand that the coronavirus is coming out of an infected person through droplets. It stays alive only for a few seconds in the air. Then we should maintain distance, social distance. And is that not sufficient? Why is sanitization of hand surface and all that necessary? Can you throw some light on life of the virus outside the body, and why dead bodies are not handed over to relatives?
Okay. See that inside the body it stays there for longer. Okay, they have the moist environment in the throat and other areas. It stays there for longer. Still, the infectivity of the dead body also so high for longer hours.
Mhm.
And as I said, no, nobody knows about the virus. We know to the extent only till today.
Okay.
So, if that is the case, if an infected body is trying to, like infect the other people, so they don't hand over the body to the relatives because it's all super spreader event then. Okay, that body and the person's handling might get the infection and it spreads to all the people who attend the funerals. Obviously, Indian scenario when death happens, like it's customary to go and attend the funeral. Like every household they wanting to go to the funeral for sure, even they're attending the marriage or not. That's like that's how we're all trained. So it's
Mhm.
become a super spreader event. Obviously, it has to be avoided considering the good thing what is going to do to the community. Second
Yes.
thing, even the initial day studies say that so the metal surfaces and the polythene bags and all carries the virus for longer time.
Mhm.
Even 2-3 days in the metal surfaces, they noticed virus staying alive.
Alive.
So only we need to sanitize the surfaces if you're, like public or public example, no need to use the home so often,
Okay.
So, but the things coming out from, like from the public, you have to sanitize. For
Okay.
example, you have an office, a lot of people coming and going, you have to sanitize.
Okay.
That's what I
Okay.
said. My consultation room, I shifted to my theater complex so that I can fumigate the room every day.
Every day. Okay. Okay.
Okay, so that is the important. So the people outside people are coming.
Mhm.
In my center rule is every patient coming to meet me has to wear a N95 mask also, and
Okay.
they have to use a hand sanitizer. Without knowledge, if they touch the outside surface of the mask, we watch them in the camera continuously. They have to use the sanitizer.
Sanitizer.
Okay, see, it looks very like odd and something we are doing over, but nothing wrong.
Yes. Yes, doctor. So I think from today's conversation, we all have gotten some knowledge or at least insight into that we have to be ready and wait for the vaccine to come, and it's not something that's going to happen overnight. And we need to stay home, stay safe, and keep wearing the mask and follow all the precautions in order to keep ourselves and our community stay safe. Is that right, doctor?
Exactly.
Yes.
Thanks for inviting me,
Thank you.
Vasudha and Fisat team, and I'm so happy that I communicated with all the public people. I think I want this message to reach as much as possible to the root level so that we can come out of this situation faster.
Thank you, Dr. Karthik. And I think this has been one of the best webinars we have thus far. And you've given us really, really interactive webinar, and you've taken as many questions as possible. Thank you, Doctor.
You're welcome.
Yes.
Take care and stay safe.
Happy Sunday, everyone.